And I also think about the patients that have had AMD and lost vision permanently and come into my office and say, Dr. Golson, now that I found you, I'll do anything you tell me to do to get my sight back. And I literally say that to patients, Scott, in the exam room. I'm like, I don't want you to be that patient. And I have to imagine that's important for you as well.
Dr. Larry Golson delivers advisory services to optometrists through his business called Sherpa Consulting. In this podcast, we spoke about the idea of maximizing patient revenue, but he didn't bring the traditional terms like just sell more eyeglasses. You probably haven't thought about growing your patient revenue in the way that he suggests, and it's smart. You're in for a thought provoking conversation. This is the Think Again podcast. Dr. Golson, I want to start by talking about what seems like the endless efforts by writers and podcasters, and I guess now us, of talking about this concept of maximizing patient revenue. Are there any issues you see in optometry that creates this appetite that is driving? I think it's always been there, but it seems like it's a topic that a lot of people are aiming to solve today. Can you give us your sense of what's going on?
Yeah, sure. Thanks, Scott. I feel like the biggest thing with the conversation around maximizing revenue is the feeling that there's all these competitive pressures on our field. I think back in the maybe 80s and 90s, you could hang your shingle and be successful no matter what. And I feel like now we really have to think like business owners and operators to be able to be relevant and to stay profitable, because it's not as easy as it once was with all the different things coming at us from a competitive standpoint.
I think that's fair. It's not so much that you can just say, "Hey, I'm an OD, come see me," right? Whether it's vision care benefits plans, lots of options on every street corner. I think that's a good point. I maybe relatedly, I want to talk about what maybe it's the ethics of discussing maximizing patient revenue. Every provider of every healthcare type does it, but can you square the matter for me of taking care of the patient the best way you can while also looking at maximizing your income?
Yeah, that's a really important question, because I've not met one optometrist in my 20 plus years of practicing that wants to come across as salesy. And I remember when I was a young buck, many moons ago, and I was up at Vision Expo East up in New York listening to a lecture by Neil Gale-Marb, who some of the listeners may remember or know. He had said something to the effect of, all right, everyone, I'm going to talk about profitability. I'm going to talk about money, and please forgive me if I've just offended anybody in the room. And I that really struck me, because even now I can get a little bit like, I would say I feel like I have to handle that one delicately when I consult for other practices with Sherpa Consulting, or even when I'm talking to my own associate doctors or team. And I always go back to the one thing that really helps give this topic a frame, which is, why did you become an optometrist, or why are you in eye care? And I hear responses from optometrists all over the place. Well, I wanted to help patients. I really like the communication, or the relationship I get to have with the patient, or I like helping people see better, or I like to treat disease of the eye. And it all comes down to this idea that, we're not their bankers, but we are here to like prescribe the best treatments and services and products for them. And so if we can think about it from that framework of concern for the patient's best outcome, and we really come from our hearts and think about, how can I help this person in front of me, and educate them, let them make the best decision for themselves as far as what's appropriate for their treatment, but still be very forthright and assertive and kind to have concern for their best outcome. I think that the money piece kind of comes secondarily to that. And we don't really focus so much on, we're talking about maximizing revenue today. But if we think about it first, the why we do eye care, then maybe we realize that if we're really good at prescribing treatments and services that are appropriate for the patient, the money is going to come irresistibly in the wake of that. And so I always tell my team and other people I talk to, it's not about the money, but we have to use the money as a metric, because if we think about our revenue as a metric for how well we communicate to the patient in a succinct and impactful way, then again, the patient's going to be able to be in a position of empowerment to make really good decisions about their care.
I want to hit on that. There's a bunch of you that are listening and watching right now that are saying, well, Larry's just saying something that's obvious to me. But what you really said, and I made a note about this in a past discussion you and I had, maybe through email, that it's about educating patients, right? That's how you start the concept of maximizing practice revenue, patient revenue. And you really lean in on that. It's about informing and educating them. I think you just said communication. Let's go deeper on that. Is that the construct? Is that kind of the basis of your construct about maximizing revenue is well-educated patients?
Yeah, it is. It is, because an educated patient is an empowered patient. And, it's one of those things where I used to spend a lot of time in the exam room educating. I opened cold in 2008, and I had all the time in the world and not that many patients. And so I would give like 2-hour exams, and I think patients were absolutely exhausted by the end of it. Couldn't make any decisions at that point. But at any rate, I learned over time and was coached over time how to be more succinct and impactful in that education. And so we have to remember our patients don't know eye care. It's like when I take my car to the mechanic, I have no idea what is wrong with my car, and I'm just basically leaning on the mechanic to tell me what needs to be done. And it's an analogy that can be brought to optometry, because if we can, again, use layman's terms or however you want to think about communicating so that we understand that the value of our communication, the quality of our communication is measured at the patient's ear. It's not measured at our own words. We have to really climb into the heads of our patients and what are they hearing and what are they comprehending. And then they, from that, can turn around and decide what's the best thing for them. And I really think about that a lot. And I even record myself and encourage my doctors to record themselves, and we review those together and listens for opportunities and where we, really hit the mark and where we might want to shift a few words here and there to have more impact, or to shorten a dialogue a little bit to make it more impactful and a little bit easier to digest. We remember that our patients are going to remember about 8% of anything they hear in the exam rooms. And so we use checklists as well to make sure that everything that we're prescribing is being brought to the next part of the patient journey. But yeah, that is really something that we think about and dissect and want to be intentional about, because, and I'll end with this because I've been speaking for a while, but we all have dialogues or monologues that we use, but we never get taught in the optometry school, how do we actually say things? Like, we never really broke it down and listened to ourselves. And it's amazing when we record ourselves and listen to it, what we learn. But being really intentional about that so that we can go back into the next exam, be a little more impactful, a little more effective. And it's, over time, we really can develop that dialogue to be the best it can be.
So, if you don't mind, I'd like to follow up on this idea of recording. Tell me a little bit. You don't have to give me the whole thing, but tell me a little bit about how often you might do it. Do you actually match language up to scripts that you want the doctors to deliver, or do these recordings deliver scripts? How does it work? Just, kind of in basic construct.
Yeah. So for the recording, first we'll start with role play with a team member. So the doctor will sit there with an optician and maybe, this is what I'm going to say. This is how I want to say it. And we kind of work through that. And if we think about the best athletes, the best musicians, the best Broadway, actors, they don't just go on stage and perform, right? They practice. And I often hear from practices that I consult for, oh, we don't have time for that. And so I encourage them to make time for that, because we're going to be more effective if we practice, or it's not going to be fumbling over our words as much. Once we've practiced and we have a base of dialogue, then we go into the exam room and we record, maybe like one a week, every other week. And we listen to them and we work on them and we workshop them until it gets better. And we, feel like, okay, now we're really at a place where we can feel confident about what we're saying to the patients. And I will say that the doctors that I've worked with, they really appreciate the opportunity to practice, even though at sometimes they kick and scream. They don't want to do it at first, because I know how to be a doctor is what I get a lot of. It's like, well, let's spend a little time looking at that and we can refine it from there.
That's very well said. I mean, I did national media spokesperson training, did work state and nationally. It has to be practiced. So now, is education's the basis of your point that well-informed patient makes good decisions. As we think about matching that up to increasing revenue, I'm curious. I'll sort of set the table and let you go bring your expertise. But do we optimize revenue first when we think about it from the care that we give the patient or from the products we give them? Is it one of them more important than the other? Just tell me a little bit about how you start to tell a doctor this is how you can maximize revenue per patient.
Yeah, I would go back to when I first opened my practice, and I thought about this a lot because I hear some doctors say, I run my practice, it's mainly optical, optical driven. And I have other, doctors say, well, I started my practice and we focus on medical. And I guess I had a big question mark with that. I'm like, why? We do have two businesses in one in optometry. It's a very unique medical field that way. We have the retail side, we have the clinical side. But in my practice, when I started, I was like, why not maximize both? And so we really thought a lot about what frames we have. I wore these cool Blackfin Italy frames on purpose today because I wanted to make a point about being unique in the eye care world so that we're not carrying the same frames that everybody else has and that you can find online easily. Really unique, fun eyewear was one of the things that we started with as a way to maximize revenue. And then the clinical side, at first, it was like learning how to bill and code appropriately with the insurance companies and the vision plans. And then also, over time, thinking about specialty care. And we started in our clinic with dry eye. And then as the IPL became more common, we ended up investing in that. And then now we're working on specialty contacts. And the only reason, Scott, that we did that was because my associate doctor went to SECO this past, I think it was February, and came back and said, we really need to be fitting these soft contact lens patients with dry eye in scleral lenses because it actually is a treatment for dry eye. And I didn't really think or know of that before. But then when I started thinking about it, well, here we are prescribing soft contact lenses to a dry eye patient, which makes the dry eye worse. And here's an opportunity to wear a scleral contact lens to help the dry eye and also help the patient see. And so we really think about that as far as in our practice, these two businesses that run side by side and how to maximize both of those, really thinking about the patient's best outcome for both.
Do you have a target number that's standard in the industry for average revenue per patient, or instead do you think about looking at what you've done over 12 months and starting to grow that? I mean, how do the numbers shake out? How do you make sense of it? How do you track it?
Yeah, so we use a scorecard, which we review weekly, and there's different metrics on that scorecard. And we run entrepreneurial operating system I've talked about before on our podcast called Traction. And the scorecard is something that in our weekly leadership meeting, we look at the numbers and the metrics and review them. And our revenue per patient per doctor, so we break it out per doctor, we do look at on a weekly basis. And we recognize that nationally, in private practice, the revenue per patient lands around $400 per patient, plus or minus. In our practice, where our more established associate doctor is pushing closer to a little over 1,000 per patient. Our newer doctor that joined earlier this year is around a little bit north of 800 per patient. And so part of that is the doctor and the coaching that we provide. Part of it is the doctor's willingness to incorporate a dialogue. I do want to mention on the dialogue, we don't script it word by word. We want each doctor to sound like themselves. We want them to feel like themselves, comfortable. We make sure that we know that we tell them, look, you're not me, I'm not you, you're going to be your own doctor here, but we also want to have a standard of care and certain points that we want to hit in your own words. And so I wanted to make that point that is important because a lot of doctors will push back. I don't want to sound like a robot, or I don't want to sound like you're asking me to sound like you.
Or memorize things. I get that.
Or memorize things. And yeah, exactly right. And so when we think about that, we recognize that over time, we are going to increase the revenue per patient goal that we're looking for the doctors. And we look for opportunities and really think of it as a collaboration. It's not like, we're not taking a stick and, like you got to produce more. It's not like that at all. And I want to make sure I'm clear about that, because if I don't say that, it could maybe be assumed. But it's more about sitting down with the doctor and saying, hey, tell me what's working for you. Let's listen to this and this recording, and kind of break it down a little bit. And so not only that, Scott, but I want to also mention our opticians, we have a level of trust in our practice that we develop over a time through something called Radical Candor, which is Kim Scott's work with Google. And she's got her own company called Radical Candor Inc. and talks a lot about how to, the little subtitle on her book, Radical Candor, is how to be a kick-ass boss without losing your humanity. And I think that's really important because it's hard being a boss. You know, it's hard to lead people and recognize that you want to be nice and kind of like their friend, but you also have to, you know, have a result that you're after and goals and things like that. And so we have this kind of like trust built where our opticians will grade the doctors on the quality of their handoff, and the doctors can go back later and look at the score that they had and where they might have hit the mark and where they might have missed something in the handoff, because we think of the doctor as kind of like creating the treatment plan and the optician going out in the optical and filling that treatment plan. And that's why we do the handoff in the exam room. And I think that that's a really important takeaway, is doing the handoff from doctor to optician of the patient in the exam room, so that the patient is clear that, hey, you're not here on the clinical side and now we're just going to go try and sell you something. Here's why we're prescribing these glasses. Here's why we're prescribing these therapeutics. Here's why we're prescribing these sunglasses to protect your eyes with the proper filters. And then the optician is next in line to help the patient. And then the doctor gets that feedback loop, you know, from the optician. And so I know a lot of practices I've worked with consulting that are like really, I don't know if the opticians or the doctors are really going to want to work together that way. And that's built on a foundation of trust. And over time, it's like, hey, we're after our each other's highest and best. We have to start with the why we're doing this and then go from there. But yeah, we do think a lot about that feedback loop and how to maximize revenue per patient. And that is an office-wide approach, I will say.
Well, and what you've challenged us that are optometrists listening to this is that we need to be a bit vulnerable if we want to lead and we want to grow. And that idea that we're going to invite feedback from our own internal team is built on a trust that needs to be constructed over time. You know, you just can't do that overnight. And I'm really thrilled you brought that concept up. So just back to the data, right? If $400 is kind of a benchmark and your practice regularly exceeds that, you're measuring the billed care, you're measuring the billed products, and part of the success you might have had is from what you just mentioned earlier, integrating new treatment modalities and technologies. Do you ever think about that? All makes sense, but do you ever think about the patient's sort of annual value? Say a patient who's really not going to change their glasses post cataract, but has glaucoma, going to come in 3 or 4 times a year. Does that ever factor into sort of average patient revenue, or are these all related to kind of your traditional 92014 examination services?
Yeah. So we do think about the lifetime of a patient's, you know, over their inclusion in our practice. And we do, I think, you know what it is? We think about it from a term of like, what's our standard of care for a patient? And if the patient has these pressures or has a family history of AMD or these pressures for glaucoma, we are going to have a standard of care of like, we should have them back in this amount of time, and this is the testing we want to perform. We think about that more from a clinical, taking care of the patient standpoint. Now, obviously, if we're doing a good job billing our insurance and getting paid, that's going to impact our revenue.
Right.
I don't know that we break it down per se of like this patient has a dollar sign on their head in a way, but we do have a standard that we want to adhere to. And if a doctor at our practice isn't scheduling appropriate follow-ups, then that's a conversation around care for the patient. And of course, that's all going to translate into revenue. But the revenue is calculated based on like kind of the number of refractions over the course of a time period by the revenue and revenue per patient. So the revenue on top of that fraction. And then what does factor in is not just the initial exam, but also kind of throughout the year, everything, or throughout a time period that we're measuring, everything that the patient might have purchased from the practice during that time period.
That makes sense. And that scorecard that you construct, do you take exports out of your software system and somebody internally sort of calculates it for your team meeting?
Yep, we have somebody that actually calculates that information. We use Edge Pro for that, and really appreciate Edge Pro for like the ease of use, because we know exactly what reports we want to pull up. We have a Google spreadsheet that we use for that, and on each one of the scorecard metrics, we have a little comment that if you hover over with your mouse, it'll pull up a little note that we've written as far as like how to pull that information, go to this report, click on this, and it's very clear about how to use the Edge Pro to actually get the data that we're after. And one of the things that we noticed was that the Edge Pro data never quite exactly matched our Revolution EHR numbers. And at first that was kind of like, oh man, what do we do about that? We're not getting the exact information. And eventually I had to tell my leadership team that, listen, it's always going to be off a little bit, just like QuickBooks is also off a little bit from all the other two. We want to be pulling the information the same way each time, so we're comparing apples to apples, and kind of just be okay with the fact that it might not be exactly accurate. Optometrists are very exacting, which we should be, but also for the metrics, we want to make sure that there's a little bit of room that it's going to be different on the actual numbers between softwares. However, let's just pull it the same way each time so that we are comparing apples to apples and have a basis.
Yeah, and I haven't worked in that area for a long time, but I do know that the Edge Pro team works very hard to do proper translation out of all the software systems into theirs. And there are some, small translation-based differences, but to your point, it's about consistency in how you grab it from where you grab it. So I guess I want to leave us with this idea of, you have talked to us about the foundations and the actions that are needed to optimize patient revenue and how you measure it. And what I love about this conversation is you didn't come in saying, I want everyone to make sure they sell, 2 pairs of glasses and high-end progressives to anybody who will take them. And so I want you to leave with, sort of talking like you would in a consulting gig to the listeners about why it is that it's more than just thinking about these little tactical actions. I mean, you've seen success from people that don't just focus in on a tactic. And that's what I love about talking to you about this.
Yeah, I'm very familiar with this idea of sell 2 pairs or sell more sunglasses, or let's give spiffs or little bonuses to people when they do that. And I do feel firmly about preventative eye care. I feel firmly that yearly eye exams are important. And I even think about that in my own health. I go to the dentist every 6 months. I have my yearly PCP evaluation. And I also think about the patients that have had AMD and lost vision permanently and come into my office and say, Dr. Golson, now that I found you, I'll do anything you tell me to do to get my sight back. And I literally say that to patients, Scott, in the exam room. I'm like, I don't want you to be that patient. And I have to imagine that's important for you as well. So your macula right there on that screen looks really healthy. And it's important that both of us partner to make sure that it's healthy when you come back next year. And that's why I'm prescribing sunglasses. That's why, for certain patients, I'm going to prescribe something like Vision Elements to protect the macular pigment. And it's not just about selling more pairs of glasses. It's really driven by what the patient needs. I don't want to sell anything to anyone just to make a sale. I don't want to be that patient that gets, sold to, but also there are actual legitimate needs that we need to make sure that we're fulfilling for the patient, or at least educating them and letting them choose. And, our patients come to us and trust us for that reason. And even when a patient says, I'm going to take my prescription and buy glasses online, I'm like, absolutely, you can have your prescription. Here's why you might want to consider buying a different pair of glasses and letting us make sure that we can control the quality, so we control the outcome that you can see a lot better potentially than what you might get online. And so, yeah, I think about it. There's a Simon Sinek video that I watched, and I actually have all new team members watch, that is about starting with why instead of what. And I'm sure you're nodding your head. I imagine you're familiar with it. And it's so valuable to think about why we do these things, because that will drive the decisions on, what we're prescribing and why we're prescribing it, so that the patient can really make great decisions. And then again, those double pair sales and, the other things that we're after for maximizing revenue from a business standpoint, they just happen, and we don't have to coerce them.
I love what you said. And I encourage everyone to go look at that video. He literally says, that when MP3 players came along, you could buy any one of them. Why was anybody buying an iPod from Apple, right? It was because they were being told that being in this ecosystem was a value. And you have really built through your practice and your patient network this community feeling where they feel like they're a part of what you do. Dr. Larry Golson, I can't thank you enough for sharing your insights on today's Think Again podcast.
Awesome. Thank you, Scott. It's been a pleasure.
That's it for today's Think Again podcast, brought to you by GPN Visions, a peer-to-peer learning community to help grow your eye care business.